Hi, everyone. Thank you so much for joining us today. We are very excited to share insights from Edelman's Global Trust Special Report on Trust and Health, specifically focusing on the U.S. Before we get started, we want to just take a brief moment to introduce ourselves. My name is Elise Galloway. I serve as a vice president within our health practice, leading efforts across public health and health equity. And I will toss the introductions over to Lynn.
Thanks, Elise, and welcome, everybody. I'm Lynn Hanessian. I'm the chief strategist for our health business and delighted to be sharing this data and really get into it, hopefully not only with our presenters, but with you as well, so that we can really wrestle it to the ground and see where our opportunities are. So welcome. And over to you, Erin.
Sure. I'm Erin Schwille. I'm an executive vice president and part of Edelman's health practice, like my colleague Lynn. I've been with Edelman for about 12 years, but specialized in the last decade or so in working with hospitals and healthcare systems. I'm very excited about the insights and the data that we're going to walk through today. And again, thank you for joining us.
Awesome. Thanks so much. So as you can tell, we have a very excited crew with us today. A few housekeeping items before we get started. Please feel free to use the chat box throughout the presentation for group discussion, comments, etc. We ask that you put questions in the Q&A box at the base of your screen so we can continually track and make sure that we're gathering your questions. We've set aside time at the end of the presentation to answer them and dive into insights further with you all. So we will get started. It's really fair to say that we are in a deeply and dangerously polarized world, especially in the US. And it's not just limited to politics. This tension has permeated into the health ecosystem, sparking a health crisis and really affecting overall health and wellness of the general US population. So before we really kind of get started into the data and insights as to why, let's clarify how society is defining health and wellness. Right now, health is much bigger than just healthcare, right? People nationwide have adopted an expanded definition of health that embraces not just the physical, a traditional perspective that a lot of us have held, but includes mental health, social health, and community livability. 66% of respondents to our survey believe that these four dimensions working together generate health and form a healthy person. With this expanded definition considered, we found that there is a really significant gap between how well people are taking care of their health and their actual health status, right? So this gap increased by 11 points in just 1 year. That's really significant. So we're going to dig into the various factors affecting health status in the United States right now. So unsurprisingly, cost came up as a significant barrier to health. That includes health options, quality healthcare, available treatments, and unsurprisingly, this affects individuals considered low income at a higher magnitude. And it's demonstrated by a 16-point difference between those considered high and low income when asked about these cost barriers. Again, unsurprisingly, this trend carries over when asked about health status. There is a startling 36-point gap between high and low income individuals for self-reporting of very good or better health. But I think amongst all of us, we know cost as a barrier is nothing new. Medical care prices and overall spending have been issues for diverse populations in the US for decades. What's exacerbating the cost challenge is inflation. Inflation of healthcare services and goods have increased faster than usual, reaching a 4 decades high by mid-2022. Pocketbooks are stretched, putting more people in both financial and health crises. And then in addition to this economic crisis and these difficult economic times, there are significant societal shifts and contributing to this nation's health crisis, polarization. Chief among them is racial and social justice. Broadly, racial injustice has become a growing concern across all demographics, with 69% of survey respondents concerned about systemic racism and racial injustice, which is up 8 points from last year. but the country is still really divided in regards to how to appropriately address it. So at this cultural standstill, 57% of individuals feel like they have seen little to no progress in addressing systemic racism and racial injustice in the United States. They've expressed disappointment and distrust in institutions' ability and willingness to do what is right when it comes to responding to these concerns. Further, no business sector is perceived as doing well at addressing racism, with only 43% of respondents agreeing that the healthcare sector is doing a good job, only 43%. And I think we can all say that without addressing these inequities within our healthcare system, we won't be able to achieve health, safety, and well-being for our nation as a whole. Lastly, we're in the midst of an infodemic. People are overwhelmed by the availability of too much information within their world. In fact, 44% of individuals cited information was a key barrier to taking better care of their health, whether that was the lack of relevant or resident information, information that was false or misleading, changing recommendations or contradictory advice. To add on, mistrust of societal institutions and leaders around the world has become a massive issue. Only 46% of respondents shared they trust media to report accurate information about healthcare. That's a 10-point drop since January of 2019. So with this societal backdrop considered, Erin is going to walk us through what individuals are expecting in this turbulent health ecosystem.
Thanks, Elise. So yes, now we're going to take a little bit closer look at how the behaviors and expectations are shifting within this challenging environment that Elise just outlined. So with an absence of trusted sources of information, people are increasingly relying on themselves and feeling quite empowered to do their own homework when making decisions about the best ways to manage their own health. And they're not just doing the research, but they're also taking further steps to validate this information across sources. And while this seems like a positive development, given the misinformation and disinformation that marked so much of the pandemic, especially around health issues in the last years, we're actually seeing a statistically significant increase in the trust people are now putting in their friends and family when it comes to health issues. So while trust in doctors and nurses and pharmacists and scientists hasn't markedly declined, these experts are now competing with uninformed voices. And so trust hasn't necessarily eroded, but influence has. We're also seeing this coupling of independent, autonomous research that people are doing, plus the rising trust in uninformed sources, leading many people, and specifically the younger cohort, the Gen Z audience, to believe that they can basically Google their way into a medical degree, which I'm sure for this audience is quite concerning. There is good news that there's still overwhelming trust in healthcare companies writ large and the hospital subsector in particular. We saw volatility during the peak of the pandemic, but that has since stabilized. Almost 3/4 of people say they trust hospitals to do what's right, which is great. However, Americans feel differently when we ask them about institutions playing a meaningful role in helping ensure they're as healthy as possible. So they may have trust in hospitals and healthcare companies, but they're disappointed in the US healthcare system's ability to deliver on its promises. There's a 31-point gap between expectation and reality. And building on what Elise shared, Americans now have high expectations that institutions across society, not just healthcare and doctors, will help them manage their health. And so with the exception here of an individual's own employer, no institution is passing the test. The expectations are high and they're unmet when we look at the disconnect between what people told us about the reality of their experience. It's also worth noting that when we dig into the subsectors and specifically the business pictured here, Gen Z, 18 to 34-year-olds, has high expectations across all industries. And so it's interesting, we found that 66% of Gen Z respondents actually expect retailers to play a meaningful role in making sure they're healthy. 65% expect the same from financial services, and 70% of Gen Z expect the fashion and apparel industry to help them be healthy. So Gen Z, this demographic with growing influence, they're the future healthcare decision makers, has a markedly significant expectation of all businesses to play a role in health. And so while in recent years we've understood that health is everyone's business, this year's data further underscores that the way we define health is broadening and the influence of healthcare companies in the traditional sense is being challenged. Digging in a little bit deeper on that trust specifically in my employer, For hospitals and healthcare systems, there's an added layer of connection between you and your providers, nurses, and other employees, given that you're all quite literally in the business of health. We saw the tumult of the pandemic create tension as the very act of coming to work put your healthcare workforce at risk. Mask and vaccine mandates exacerbated some divides in some population segments and areas of the country. And there was this fragility to the trust that providers and employees had in your organizations to address health-related concerns and help keep them safe and healthy at home and at work. While the level of acute COVID-19 risk has abated, the continued staff shortages, workplace violence, and burnout that's prevalent across the healthcare workforce still persists. And so for your colleagues, for your staff, it's critical that you reinforce the programming and dialogue that helps maintain trust in your ability as an employer to address health-related needs and concerns. We also saw in our data that there's a need to meet the expectation that organizations prioritize and model mental health from the top. So as Elise had pointed out, 88% of Americans see mental health as a key dimension of their overall health. And the exhaustion and burnout that was so prevalent across the healthcare landscape, there's an overt prioritization of the way mental health grounds your continued ability to retain your workforce, recruit new providers, nurses, and employees, and to compete with the increasing trend of traveling healthcare providers, let's say 74% of whom, according to recent research, say burnout had a great deal of influence on their decision to move in that direction and choose traveling as a career choice. This increase in traveling positions is not only an expensive proposition when it comes to staffing, but also threatens the critical connection between providers and their patients, which Lynn is going to talk about in a moment. So net here is that our data kind of reflects that platitudes on badges and free pizza in the break room no longer cuts it as a workplace benefit. You know that, you're feeling it, but the data really does show that people now expect their leaders, their employers, to normalize the prioritization of mental health and empower them to do the same. So I'm going to hand it over to Lynn to talk a little bit more about what we do with all this information and what we do as a next step.
Thanks, Erin. Okay, let's solve the problem. One of the reasons why we focus on trust is because we know that trust influences behavior. And it's not just a single point or a single relationship. Frankly, to follow a doctor's order, people need to have trust in their health system. Remember that empowered patient population, those folks who are getting their Google MD, those folks who are relying on friends and family. For those who believe that their health system is failing them, they are much more likely to follow advice that contradicts the recommendation of their doctor. The same is true for social media. So we have to find a way to build in confidence, not only relying on a positive doctor-patient relationship, but also in the whole health ecosystem to help take advantage of all that we've done in figuring out how to help people stay healthy, but also how to improve the impact of what we do day in and day out in hospitals, health systems, and other players in the health ecosystem. The other piece, just to give a little bit of hope, not all is lost, right? Those that have lower trust are going to turn to different trusted sources than those with high trust. And that gives us a little bit of hope, actually quite a lot of hope, and really some specific guidance. What we know, if we look at someone who has low trust in the health ecosystem, friends and family are the most trusted source versus those that it's their doctor. For those who we think about as sort of the most believable channel, our employer, one of our most trusted relationships, is the most believable with health information versus those with high trust already, national health authorities. And here, a moment of importance, the most convincing health expert recommendations for those with low trust has their credentials at the fore, but also lets our person have a conversation, help them to ask questions and answer their questions. So we can build trust if we build engagement, if we build conversation. And frankly, I would say, while using informal and clear language is important for higher trust populations, it is equally important across everyone that we're engaging with, because that is what allows people to get their heads wrapped around the information and to take the kind of behavior steps that we're looking for them to take. Now, the other pieces that I think are real important is that to drive those healthy habits, we need to make sure and we are happy to make sure that we can overcome some things like social determinants. Sure, when respondents are highly educated, they are more likely to make a positive health change, such as diet or exercise. But if someone has a good relationship with their healthcare provider, someone has trust in their ecosystem, that also bolsters the impact of what you're doing. So we do not have to say, well, I can't change this person's status or income. In fact, we know that we can overcome this by engaging with our populations and also just building trust in the health ecosystem overall, so that people have the confidence and that disposition to, frankly, change their behaviors and help to improve their health. Now, how do we think about this from a provider perspective? We were having a conversation this morning. If you think about a doctor who pursues oncology or primary care or anesthesiologist, lead among their characteristics is not necessarily being a good communicator. They may have tremendous expertise, tremendous talent, but we also need to help our providers recognize that they're treating the whole self when they're treating their patients. I'm reminded when my mother was being treated for cancer, her oncologist had also the experience of his wife being treated for cancer. He wrote a book after it, and he said that experience helped him to understand that he wasn't just attacking the tumor and getting rid of the cancer, but he's taking care of the whole patient. So how does this translate today? One is we need to think about, how do I treat my medical needs? And that means upping customer service, right? Showing our patients the respect they deserve, not a lot of long wait times, not rushing through an appointment, but having an opportunity to give the information, the medications, and the follow-up that's needed so that they can embrace the recommendation. The second is ease their concerns. Listen to that patient, take their concerns seriously, and frankly, put the information, not talking down to the patient, but tailored to the needs of the patient. Put them at ease. Don't judge them. You may not know why that person is anxious or frustrated. Take that time to understand them. And then the third piece that's really, really important is care about these folks as an individual. Understand that they may have concerns outside of what is going on in their health care interaction that may influence their ability to fill the prescription, to follow the recommended routine, to change their behaviors in a way that they have a positive outcome. So we need to figure out how we tailor our counsel and our guidance and put it in the context of the life of that patient. Now, for experts, and this is often the voice that our communicators play, and as we elevate our leaders, we need to make sure that we're talking to people as if they're an equal partner. If we want folks to change their behaviors, we need to include them in the science. We don't just say one or done, take this vaccine. We need to show that recommendation based on the science, and also make sure that that data, that science is coming from a population that is a lot like the patient in front of you. Where might we have dropped the ball in vaccines? Maybe not including enough information so that people understood the steps that were being done, not to shorten the level of evidence, but to speed up the delivery of an innovation. We also need to think about how, as experts, we're providing recommendations that fit within someone's life. You know, we may think about what someone is going to be eating every day and say, well, you need to do more of this. How do we understand that in the context of someone's culture, in the context of what's currently on someone's plate? We need to also acknowledge that sometimes this stuff is really hard. Diet and exercise change are hugely difficult to achieve. And so we need to have some empathy in that communication. And we also need to make sure that in that communication, we are giving a voice to the people we're reaching out to. We need to make sure that we have a mechanism for folks to pose questions and voice their concerns and then respond to them. And that's also part of that engagement and part of that intervention that will make a difference in how we try to bring health back to more people. So the other piece is we've got a lot to do in our daily lives. We have to care about our employees. We have to care about our patients. We need to care about the future generation. In some cases, we need to care a lot about our retirees. When we say to the folks who participated in our survey, what does business need to do? There is a high expectation that businesses will address the societal factors that affect our lives. You may recall Elisa's definition of health. It's pretty broad reaching. Within that, the issue of discrimination is called out. The experience of stress in one's lives is not beneficial to people's health. So that's why we need to think about the communities in which we live, as many of you serve as anchor institutions in the communities you serve. We have that expectation that to improve people's health, business must improve the health of our local communities, that we need to provide trustworthy information, and frankly, take on the issues that are driving health. I happen to be sitting in the Northeast today, and I know that the air quality, while it looks clear, is pretty poor. These are things that we have to understand, and we also have to recognize the inequity associated with the ability to keep oneself safe and the exclusion that too many people feel when engaging in our health system. And finally, don't do it alone. The goal is to bring more into the solution. We aren't expecting, one player in the whole health ecosystem to make a difference. We aren't thinking about just the role of one or institution. We recognize that our lives, our health are influenced by a myriad of groups. So let's bring folks together and find solutions that not only are sustainable for us as organizations, but for the populations that we serve, both inside and outside of our organizations. So let's bring it to some final recommendations from us. I will say, and this was care of some conversations we had this morning, we know that trust is anchored in action. And some of those actions are your strategic communications initiatives. And I think that when we consider the work that we're doing, we need to be taking a look at all of the factors that people understand burden health and find solutions, whether it's addressing inequalities, providing access and affordability, to leaning into the dispersion of authority. We know friends and family have a lot of power. What can we be doing to design our care, our communications, our engagements to embrace that? And we know in some cultures, the family is very much involved in a decision. For example, when patients may be going to dialysis, that is a family decision and engagement. Invest in employee health, recognize the personal connections between the people within your organization, of course, and outside, and amplify the opportunities for them to be authentic champions for the work that you're doing as you lift boats in your institution, raise other boats, and then think about optimizing the business around health. Anchor institutions do this all the time, considering supply chain, considering all of the factors and the impact that you have to really make a difference. We find that a lot of our work right now is partnering with our clients to step back and reconsider their comms efforts overall, to acknowledge that it is not one size all, and we have to tailor. We have to be as good as the best consumer brands at having a direct and engaged relationship that is tailored to the needs and the perspectives of each of our individuals. And we also need to really understand that trust we may have today is bolstered by the actions that we engage in today and tomorrow. Very important to continue to work on that. And the other is really acknowledging, in many cases, our employees are our community, are our patients. And so there is a virtuous circle in doing well, very much by the ones that are providing our front lines, but also are providing the safety net to those that we serve. So the one person who has not been introduced is our colleague, Gianna, and I'm going to hand it over to her to move from data to dialogue and discussion.
Thank you so much, Lynn. My name is Gianna Lasquadro. I'm an account supervisor within Edelman's corporate health practice with a focus on hospitals and providers. So to get us going, I know Elise just asked the group for any questions that may be percolating in your minds. To kick us off, where do we start to increase trust as a whole?
So I'll kick it off, and then I'll hand it off to my colleagues. I think that trust comes from sort of two features. One is, don't take for granted your markets, make sure you're always aware of who you're serving, listen to them critically, and adapt to where they are to bring them into a trusted relationship. So it's really sort of it's sort of in a person as old as I am, it's that continuous improvement model of not relying on those things we used to do, but always measuring and ensuring that it's aligned to what we need to do to get to the impact we have to have.
I agree wholeheartedly, Lynn. I like to kind of have a formula of sorts in regards to establishing trust. And the first thing is really starting with data, right? Invest in research to better understand the populations, the stakeholders you're hoping to engage. Maybe that includes social listening, maybe that's surveys, maybe they're roundtables, but really understanding the day-to-day experiences, the beliefs, the behaviors that they are living out day to day. And I think that is followed up by prioritizing relationship building and engagement, right? So whether that's with policymakers and other providers, private sector business leaders, community leaders, it's really important that we foster collaboration and authentic and genuine collaboration among a variety of different stakeholders to not only bring them into the fold, but co-develop solutions that are both scalable and sustainable. And I think, as Lynn said, just meeting people where they're at, right? That it all stems from genuine care, intentionality, mutual relationships. Make sure you're leveraging the right platforms, the right venues, and you're translating information and action in a way that's really relevant and resonant with their lived experiences. I think kind of those three things are a really great way to not only spark action, but action that leads to trust building.
Excellent. Another question, this is for Elise. So you noted that the healthcare system isn't doing well in addressing racism. We have a DEI program, but it isn't visible externally. How can we demonstrate our commitment and effort?
Awesome, that's a great question. I want to start off with distinguishing between DEI and social impact efforts like health equity and other things. So DEI, diversity, equity, and inclusion, they're three closely linked values that obviously a lot of our corporations and businesses have invested in. And it's all about working to create a supportive environment for different groups of individuals, whether that's racial and ethnic differences, religion, ability, gender, sexual orientation. It is really focused internally on employees, right? Whereas social impact efforts, they're really integrating social issues, concerns, challenges of the day into business operations and interactions with stakeholders, right? So that's externally focused. Let's focus on the community, the world that we live in, et cetera. So while these two things are different, I think they take a really similar approach in regards to amplifying those efforts. So, and I think it kind of runs through kind of the three kind of prongs that I was just speaking to in regards to listening and meaningfully engaging those stakeholders, prioritizing those relationships, and co-developing solutions along the way. And what I think by following that kind of mini formula, you're able to encourage and I think organically have those stakeholders, those individuals that you're impacting and are engaging with, become ambassadors to your efforts, right? And we really love organic amplification. I think that's really the best way, especially when it comes to whether it's DE&I or social impact, being able to amplify the voices of individuals who are engaged with and impacted by those efforts organically is a really great way to not only share the great news and the great efforts that you guys are doing, but also build that trust and build brand equity. So.
Well, and layering onto that too, I think, Lynn mentioned convening as a critical way to build trust, especially from the business perspective. And Elise, you're talking about partnerships. I think there's also such an opportunity for health systems, hospitals, providers to really think about elevating other voices as well. We saw in some of that data, right? This dispersion of authority, and Lynn mentioned we should lean into it. So I think there are opportunities where it's not just convening or partnering, but also just using your power, your agency within your communities as anchor institutions to then create new spaces for other voices that may be more trusted, that may be community members, faith-based leaders, friends and family of impacted patients who are perhaps going through something the community is rallying around. Giving them voices, whether it's social media, whether it's doing events, whether it's elevating them as spokespeople in some specific areas of your organization, just bringing that diversity of voices, partnerships to elevate others, to have that more authentic representation, not just of what you're doing and pushing that out, but how you're also bringing others that idea that, you know, all the tides lift all boats.
Yeah, so I'm going to, Amy Heatherton has added a great comment in the chat. Government policy has enormous impact in healthcare's ability to overcome many issues faced by healthcare systems today, especially reimbursement variation state by state. I think the other piece that we cannot lose sight of is, you know, yes, we had the pandemic. Yes, it was a big deal. But if you look at things, and I saw a piece this past week about match and pediatric subspecialties and why our pediatric subspecialty slots continually underfilled. Well, it's underfilled because pediatric subspecialists get less money than adult subspecialists. And we have to find a way to rebuild a commitment and a momentum around healthcare systems. I will say during the pandemic, I was acutely aware of healthcare system capacity. And I do think we need to find solutions that ensure we have a sustainable healthcare system and one that overcomes the sort of pernicious hurdles that are put in place by ill-conceived policies, and frankly, solve problems that we have had for a long, long time. Pediatric subspecialty match was horrible before the pandemic. It's pretty bad right now. And I am hoping, you know, that in some of the relationships that were built during the pandemic, we might be able to put together coalitions that can push hard on some of the issues that absolutely sort of structurally underpin the problems in our health systems.
To that end, Lynn, how do we measure progress in building trust?
Measurement, for someone who started her career in evaluation research, is a favorite of mine. And I think it touches on the comments that my colleagues have said. We actually work with a number of clients on measuring trust, on tracking their trust in vis-a-vis their competitors, and also trying to identify those specific drivers of trust. I think in our digital world, there's more and more ways to create a kind of, as I say, trust dashboard that allows you to track what you're doing, how you're doing, and assess whether or not the dollars you're spending are getting that impact. I think it's a mixed, as in a mix of different sources that need to come together to solve that. And you've got to match your sort of trust metrics with your business strategy and also your overall business performance. And putting that kind of effort in place is important because, frankly, in some cases, it builds a really strong argument as to why you need to be investing in some of the programming, in some of the communications efforts, and frankly, in some of the training efforts that are important for your organizations.
Erin, here's another question. Our leaders promote programs and benefits that focus on work-life balance, but we hear that we aren't doing enough. How do we make modeling more visible and effective?
Absolutely. So I think during the pandemic, especially, we saw the decline in workforce morale. We saw burnout increase. We saw the physical and mental health impacts. And at that point, leaders were solving real operational challenges and navigating a lot of real pressing time-sensitive needs for the system to continue to operate, quite frankly. Since the pandemic, I think we've seen that erosion of trust in leaders to some extent, and it's been hard to rebuild. We know that a lot of our clients, a lot of hospitals and healthcare systems do a really great job with leadership rounding and meetings with a lot of other directors, managers, supervisors, and above. But what I think there's an opportunity, and we've seen a lot of success in creating more opportunities for leaders, not just at the C-suite level, but those who maybe have influence, not in title, but in tenure, in relationships. Every system has that, oh, ask Nurse Ann, she knows everything. Having more of those people do intentional listening sessions, do intentional rounding. This doesn't have to be formalized focus groups, but this needs to be a place where people feel heard, and where leaders are also modeling that they're taking the time out of their day to not just ask how you are, but to also get that feel for themselves of being part of the culture. that multiple touch point, real human presence is critical in not just feeling like people are getting HR updates about benefits they can use outside of their work, but instead feeling like internally there are people who are taking the time and showing that human connection is important and is part of looking at people not just as your employees, but as a whole person and the way that they're existing within the world.
Great. We have time for 1 or 2 more questions if anybody has anything, or just open discussion via the chat.
I'm going to throw something to the panel, and I think hopefully to many of the folks on the line. While we're hopeful about the ability to improve our digital engagement, I think everybody should be prepared for the coming of the not only Google Doc, but as someone said this morning, the ChatGPT doctor coming into my office. And so I think everybody needs to be prepared for that. Ultimately, it's the democratization of information when put through a more critical lens and ruled through other authorities, as it were. It may be very helpful, but we're already beginning to see a number of organizations faced with people coming in who have done their own higher level generative AR solution to the problem at hand. And I will say, and I would love Elise's comments on this, part of the problem is the data that's being pulled from is already not reflective of the communities that live in the places that you serve. And so you're going to end up with sort of compounding bias with what people are doing to define their world around them. And the authority that their Google delivered MD has with it coming into the office.
No, and I think that's a really amazing point. And as we lean in further and further into AI doesn't have to be a scary, terrible, negative thing. We have to approach it in a strategic, well-informed way. And Lynn is alluding to a conversation we had earlier today, but what's interesting about maybe 5 years ago, 2 years ago, individuals could pull up on their phones an article, a research study, something, and share that with their physician or their primary care, or their provider, and be like, this is what I'm reading. This is the source. With ChatGPT, with AI, it's bringing together information from the universe of the website, of the interwebs, and it's not able to pinpoint exactly what that reference was. And so that leads to a lot of not only ambiguity, but a lot of risk, a lot of misinformation. There's not all accurate information on the internet. And I think we all are aware of that. And so I think we have to be very careful in regards to the Dr. Google era that we have been in probably for the past 20, 30 years. And now what we're ushering into by force, almost in a way, the ChatGPT doctor in a way. And I think Lynn also alluded to a really good point that we have to make sure that the information that we are either communicating or we're providing to the audiences is really reflective of their lived experiences. Is this treatment option, was it informed by a population that looks like me, that experiences life like me? Being able to reflect that demonstrates intentionality, but it also builds trust. So some things that we have to consider going forward.
I would also just add that I think with the ChatGPT thing, at least you alluded to, right? It's sometimes seen as the scary, terrible thing. And we know in some circles people are using it, but are afraid to say so, including within the medical community. The New York Times did a great article about that recently, about doctors using it actually to practice empathy. But what I think is interesting from a communications perspective is that we know that patients and families and community members are going to be trying out these sources. We know that they don't want to be shamed. They want to feel empowered and they want to feel like they have a voice. I mean, Lynn really drove that home in some of her data, right? They need to feel respected for their opinion. They need to be brought along on a journey. So from a communications perspective, while there's a highbrow trade industry conversation about what does ChatGPT and what does AI mean, and there's the scaremongering side of it, I think for hospitals and healthcare systems to think about owned content, think about ways to engage conversations that say, yeah, we know you're looking at that. That's great that you're looking for other sources and trying better to understand. We want you to feel comfortable, confident to then bring information and be ready for a dialogue with your doctor, right? So it's not discounting their research. It's not assuming that it's wrong, but it's making that call to action be, feel free to do that, but please plan to have an open discussion. We want to understand where you're at so we can meet you there and then help make an informed plan together where you feel empowered and we all feel good about the treatment or the path forward.
Well, I think we're almost at time. So this has been a really great conversation. And we thank you all for attending. We will be sharing a link to this webinar following the meeting. And I believe all of our names and contact information were on the invites that you received. So please reach out to us with ways that Edelman and any of us can help you, and have a great rest of your day.
Thank you so much.
Thanks all. Take care.